Okay.
Hi, I'm Bev Chapman, and we're going to be talking about understanding congestive heart failure and hypertension. So congestive heart failure occurs when the heart no longer has the ability to pump blood to meet the body's demand. Hypertension is the force within the arteries, within the circulating blood, that exerts a force on the walls. Okay, sorry. Our objectives in this PowerPoint is to learn the anatomy of the heart, the conduction system of the heart, how blood flows through the heart, and what makes the sound of love dub, and the cardiac output. I have to say this. So as we move through this PowerPoint, you will be able to understand the heart's anatomy. When the heart's physical structure, conduction system, and blood flow are intact, it is a powerful pumping mechanism. Next. So, I showed you guys the normal anatomy. Excuse me, guys. So this is showing how blood moves through the heart, how it comes from the body and goes through all these changes. I could really repeat it for you guys because but you know, I'd rather let you see the video. And this one should be easy. There, I did click play, right? Wait, you told me the bottom.
Go into, it should be just like the other one. Go into the box.
What box?
Right there, and then double click it inside the box.
Oh Lord.
On this one, what if you click on the arrow?
Where you see the arrow?
Right before it says video short, there's a little arrow.
Oh. Yes. Hopefully this will work. Did it?
Mm-mm.
What'd you do to my video? Heck. Well,
Go to slideshow. See at the top where it says slideshow, and then say from current slide.
You think we can do it from memory, Brittany?
From current slide.
I'm having a hard time moving.
There you go. Okay, now do it. Now click it.
Oh yeah.
Inferior, no, super inferior vena cava
Oh.
to the right
I'm
atrium.
Yes.
To the right vent.
Yes.
Through the tricuspid to the right ventricle.
God,
it goes
it won't
up
play. It was just
to
for a
the
minute ago, so it won't play.
Pulmonary?
Yeah.
Okay, I'm gonna back it up and go through it for you guys.
You have to be on the slideshow itself.
I was.
So click on slideshow again.
Let's see. Hold on. Sorry for these technical difficulties.
You got to click on slideshow at the top.
I can't get that.
No, it won't do that. So go to slideshow at the top.
Where do you see that? Oh,
There.
did I pass it? Oh. I'm trying.
Okay, you have to be actually in the slideshow in order for it to do it. Otherwise, it's not going to do it.
See how I got stuck that mouse?
Okay. And X this off. Slideshow.
Pulmonary valve.
From current. Okay. We had it on there.
I know, it was.
X this off. Okay, slideshow from the current. You have to leave it there if you're going to show a video. Okay, let's go out of this one. We're on slide 6. Show from current. Say okay. Okay.
There was
now
something that said in the content. Maybe it'll go back.
to skip over it until afterwards. It's not.
I saw something that said enable contact. Can you go back? Okay, so when you went to get that thing popped up. Oh well. Right here, wait. Enable external content.
I did that the last time. Let's see.
Okay, we'll just
Okay.
leave it alone.
Yeah.
So you wanted to know, let me see, how do I go back? You wanted to know about the soul and the heart. Okay, since I don't have my notes, I'm gonna try to remember this like I did when I was in school.
We can do that later.
We could?
Yeah, we can
Okay.
see if we can get your video up.
Okay, so then just keep rolling on.
Okay.
Okay, so the heart's conduction system consists of the sinoatrial node and the atrioventricular node. So what happens is the SA node, which is what it's referred to, and it's also referred as the pacemaker of the heart, it sends a signal to the AV node, and then the AV node, it comes down the AV node and it goes into the bundle of His, and then from there it goes to the Purkinje fibers and it contracts. So it's all a part of the pumping and contraction system that comes together, which is why I thought this was pretty cool. The sounds of the heart, the lub-dub, when the tricuspid valve, where did it go? Sorry, y'all. When the tricuspid valve and the mitral valve close, you hear the sound of the lub. And then when the second sound is when the pulmonic and the aortic valves are closing. Cardiac output is the amount of blood the heart pumps through the circulatory system in a minute. The cardiac output is equal to the stroke volume times the heart rate. The SV times HR equals CO. Preload and afterload. So preload is the amount of blood in the ventricles after diastole, and the afterload is the pressure of which the heart has to contract to eject blood. Etiology of congestive heart failure is structural abnormalities, coronary artery disease, diabetes mellitus, diastolic heart failure, and systolic heart failure. In systolic heart failure, it occurs when the heart is unable to contract or push enough blood out. The heart is weak. Diastolic heart failure is an inability for ventricles to relax, and that some structural or impaired ventricular filling would cause these issues. Here's a chart. On the left, you can see the normal heart and diastole and systolic pumping, I guess, systole. And down the middle, sorry, let me go back to that. Down the middle, you can see what systolic dysfunction is, and to the right of it, of this chart, it's the diastolic dysfunction, which you could read this since you guys got copies. Early signs and symptoms, you'll see a patient with dyspnea on exertion, some ankle swelling, hepatomegaly, and a nocturnal cough. Oh, dang, I'm messing with it. I would leave it alone. Later signs would be pleural effusion, tachycardia, heart rate over 120, and acute pulmonary edema. Okay. Some testing labs for congestive heart failure, chloride level, potassium level, calcium level, carbon dioxide, magnesium, lipid profile, CBC with diff, a stress test, and an electrocardiography, and a sodium level. I also think that they would do hematocrit and hemoglobin and stuff like that. So medications that they use are some of the same ones that they use for hypertension: beta blockers, ACE inhibitors, calcium channel blockers, antiplatelet therapy for some people, aspirin, or diuretics. And hypertension, I don't think you always saw this on the chart. I think that you would just see hypertension, and now you see primary essential hypertension, mostly essential, and that's high blood pressure that is not related to a medical condition. The secondary hypertension is related to a chronic disease condition such as kidney disease. And when I was doing the research, there certain books have a variation between what the normal blood pressure is. But my doctor always said it should be under 120 and definitely under 80. Okay, you guys probably...
Do you know what the current blood pressure is?
They moved it to 130.
30, okay.
But a lot of your physicians are still going to be on the conservative side and say 120. They moved it up.
I thought they moved it down.
They did. They moved it down. Then they moved it back to the 120 over 80. And now they've moved it up to 130. But that's for a healthy person. If you have somebody that has comorbidities, they want it lower, right? And I think most of the physicians are still saying they want it lower. I wanted to go on when she said that. I wanted to see what the American Heart Association has said. Maybe I can do that well.
Okay, so you can't really read this, but it's depicting the blood flow within the arteries. And threats of hypertension, which is so true, like stroke, the things that take place in the upper part of the brain. You see some people have a lot of TIA, those transient ischemic attacks. They seem to be precursors to later on having a stroke. And loss of vision, heart failure, heart attack, kidney disease failure, sexual functioning, excuse me. So these conditions, if I had an umbrella, I would say hypertension, diabetes, renal failure, and cardiac issues seem to all hang out together. And this is another picture of blood pressure depicting how it is, the pressure within the arterial walls. Some predisposing factors are obesity, having a sedentary lifestyle, obstructive sleep apnea, diet, alcohol use, smoking, NSAID use, and having the metabolic syndrome, which is high blood pressure, obesity, and what is the other one? I'm having brain farts today, y'all gotta excuse me. So high glucose, high blood pressure, and what did I say? Oh well, gonna have to look it up, but anyhow, with the metabolic syndrome, I think most doctors are warning you when you're at the start of it or in the middle of it, and people just don't get it. But it seems to lead to diabetes.
The American Heart Association is still listing normal blood pressure less than 120 over 80. So, and then elevated at 120 to 130. So, and then high blood pressure greater than 130. So,
Testing
yeah.
purposes though?
I would make it not in that range. I would say, what is normal blood pressure? And I probably wouldn't list 130. Your book talks about being as high as 130 being a normal blood pressure. So I would go by what the American Heart Association says.
Okay, and so hypertension complications, as I said, in the brain, stroke, and probably those TIAs and headaches. You see retinal problems with the eye, and with the blood, elevated sugar levels, and heart attacks, kidney function problems.
And stroke.
I thought
Too.
I said that already.
Did you? I didn't hear you say it, but
Yes.
yes.
Okay, so what some people might want to do is start with diet changes, and believe me, I know it's hard. They should eat a colorful variety of food, maybe try the DASH diet. What I don't have up here is the Mediterranean diet, and that seems to be the most popular one. Low impact exercise and meeting with the nutritionist. For some people it's hard because when you meet with a nutritionist, they want you to write everything down that you eat, and some people, they just can't do it.
The DASH diet, do you guys know what that is? What you would eat on a DASH diet?
I'll go back.
It says fruits, vegetables, fat-free or low-fat milk products, whole grain, fish, poultry, beans, seeds, and nuts.
So yeah, hearty fruits and vegetables, and the key is fresh fruits and vegetables, if not fresh, frozen, if not frozen, canned that are rinsed off and preferably low in sodium, because you can use your colander and rinse off those vegetables. Do you lose some of the food value? Yes, you do. But for people that don't get to the store regularly, can't afford, eating canned, at least if they rinse it, and if they can buy low sodium, that is better than not even eating vegetables at all.
Yeah, I used to buy canned all the time, but I don't anymore unless it's like I'm gonna make chili and beans. I basically get fresh or frozen. And frozen, after a while, tastes fresh. To me, anyway. Some nursing diagnosis for congestive heart failure: decreased cardiac output, anxiety, impaired physical mobility. They may have a knowledge deficit and excess fluid volume. Nursing diagnosis for hypertension is a risk for decreased cardiac output, knowledge deficit, activity intolerance, overweight, and ineffective coping. Did I skip? Okay, some support groups. I never heard of heart.org, but I think it's a part of the American Heart Association, because this little heart thing comes up when you try to research certain things. And I've never heard of myclevelandclinic.org either, but they have a lot of information that you could use and would help your patients if they're looking for a support group.
So heart.org is more about the educational pieces from the American Heart Association. The American Heart Association at first talks about the standards, talks about why heart healthy is important, talks about signs and symptoms of stroke, but then the heart.org gets more into about diet, sedentary lifestyle, exercise, that stuff.
Have you heard of the My Cleveland Clinic before too?
The Cleveland Clinic does a lot of research on a lot of different topics, and they put out a lot of really great educational filming. So you can go there and find information.
Yeah. Okay, some tests and treatments. So the book I was researching says adults 40 years and over should have at least an annual blood pressure check. And then it said if you're an adult 18 to 39, you needed annual checks only if you had like risk factors like obesity, and then labs for high cholesterol and elevated glucose levels. I had to share this with you guys. So I was a diehard Dr. Oz person. I don't know if you remember this. I don't know if it was in the news, but he was against statin drugs. He swore up and down it wasn't good for you and everything. So a lot of people who followed him listened to him. And then somebody came on and proved him wrong. So I fought with my doctor over, no, I don't need a statin drug. It's gonna do this and that. And then she called me one day and said, are you taking those pills? I can't see that you're taking these pills. Do you know, when I started back on the statin drugs, my cholesterol dropped significantly. So I just want y'all to know that in case you have to come across somebody to share it, because it was really eye-opening for me. Anyway, so what I have next is this research piece, and it's about, well, let me let you see it. Hopefully that'll play for me. I don't know why I always have trouble with my mouse. I got it.
A special gel could be used to help repair damage caused by heart attacks.
British researchers created it, as CBS 4's Michael George tells us. The testing is still early, but the gel is showing promise.
This is a microscopic view of mice heart cells, still beating and swimming in a gel made of stem cells. These heart cells are healthy, but researchers at the University of Manchester believe the stem cell gel could be used to heal damaged heart tissue following a heart attack.
Once delivered to the heart, it stayed in the heart and it remained there for 2 weeks.
The gel also kept the regenerating stem cells alive and functioning. In the past, surgeons have tried to repair heart tissue by injecting stem cells not encased in gel into the heart, but the cells have not survived.
It's looking like a very promising kind of the way that it would stay there and be able to hold the cells there for long enough for them to kind of integrate into the heart.
The next step for researchers will be to inject the stem cell gel into mice heart cells damaged by a heart attack. If successful, human trials could follow.
In order to get into clinical studies, we have to ensure that the hydrogel itself is compatible with the human body, that the stem cells are produced in a way that is safe and reproducible. It will be a matter of years before this technology can get through into the clinic.
Coronary heart disease is the leading cause of death worldwide and in the U.S. Michael George, CBS News, New York.
And researchers say the best way to keep a healthy heart is to prevent heart disease in the first place with a healthy diet, exercise, stress management, and avoiding all forms of tobacco.
Okay, see how to get out of this.
Click on the square see the square in the right hand corner?
Okay,
Click that off.
Click this one.
Mm-hmm.
Again.
Okay. And then just click on to the next slide.
That's not working. Let me find an X somewhere.
No, see you have those arrows at the bottom left hand side?
Oh, here?
Go down further into the
Oh.
PowerPoint there. Click on that.
Okay, I didn't even see it.
There you go.
So the thoughts on research is my own personal thought. This research with heart stem cells encased in a gel shows great promise for repairing heart tissue. I know that human trials are some years away, but it is exciting to know that one day the scientists will be able to revive the part of the heart that has died in patients who have suffered from myocardial infarcts. Because I remember as we're coming through the nursing program, one instructor saying wherever that infarct is, that part of the heart dies. So I was thinking if they could put some sort of gel on it that would heal that part.
Isn't it
That-
time that matters? With that?
Yeah. So what is it that we should educate people about? Somebody's having chest pain, they're at home. What do they need to do?
Call help right away.
Okay.
And take a nitrostat if they have
If they have them, yes. Should they drive themselves
No.
to the hospital. No, which is what some people do. Should they go just lay down?
No. Well, they should maybe rest and see if it gets better with resting.
So what we say on the first symptom of a heart attack, I think I have chest heaviness, I have that, pain down my arm. Women in the back, they need to get to the hospital ASAP because we have 60 minutes to open that heart up in order to, the clot, okay, it's at the base of the heart or the, side of the heart. And the longer we wait, that clot is pushing and pushing and pushing through that cardiac wall and into other parts of the heart, which causes damage. So if we can open them up in 60 minutes, go into the cath lab or less, we have a better survival of the patient, better survival of cardiac tissue. Okay, so that's what we do tell them. In the hospital, so all hospitals, the patient comes in, it starts with admitting. They come in, or with the EMS if they've, called. EMS is going to radio to the ED, and they're going to tell them, we have a patient in cardiac arrest or a suspected. The staff is there to meet that ambulance. And then the cath lab is called as soon as they get that call from EMS. Cath lab is on their way in. Some hospitals will say you have to be there within 20 to 30 minutes. Cath lab's opened up and it's always set ready to go. We take that patient, we don't even stop in the emergency room, we take them right to the cath lab is what we do. And then, they come back, did we have to stent them? Was there a different problem? Is this patient going to need further extensive, okay, we've done the cath lab, now we know what's going on. Do they need further care than what this hospital can do? Are we going to move them to a different hospital? What are we going to do? But the sooner, the better that they get in. And so we say to the hospital within 60 minutes.
Lori, do they still tell patients when you're at home and you feel that heaviness, like chew an aspirin and then call 911, or is that just old and archaic?
No, they do say that, but it's going to depend. You're going to work with your physician because not all patients can take aspirin.
Right.
Okay. So if that's what your doctor says, to do, or if that's what, I took one baby aspirin, I am calling the squad, or sometimes when the squad gets there, they're going to give you a baby aspirin or 81 milligram aspirin. It just kind of depends. If they have, nitro, that's going to be the first thing.
Yeah.
So aspirin definitely is something that we would do. We're going to put oxygen on that patient as well.
Oh, okay. I think that wasn't it in the PowerPoint? I don't know. This was this quiz thing that I was trying to do and couldn't figure it out. Yep.
Okay, so I found on YouTube, it's a down and dirty blood flow through the heart in 2 minutes.
Okay.
Let's kind of go over that and you guys can say, test your own knowledge.